A very good morning to everyone. Welcome to another episode of Sri Knowledge Academy weekly Sunday webinar series. Today we have a very interesting topic. Before going on to the topic, let's go to see some housekeeping rules. The webinar link will be open for you to join in from 9:15 to 9:45 a.m. No late attendees will be permitted after 9:45 a.m. You have to stay until the end of the lecture to obtain the CPD points and the e-certificate. Kindly keep your mics and videos turned off during the lecture. If you have any questions, you can type it in the chat box. You can ask at the end of the lecture. Now let's go to the today's topic. Today the topic is mental health literacy. It is a very timely lecture and it is very important in the current context of Sri Lanka. Today our lecturer is Dr. S. Sivathas, consultant psychiatrist, teaching hospital Jaffna. Dear sir, over to you to conduct your timely lecture. Thank you very much.
Right, thank you. So, good morning to everybody. So I don't want to spoil your Sunday morning. So I try to make it a very easily understanding presentation. I'm going to do the PowerPoint presentation now. You can ask questions after that. So I'm going to share the PowerPoint presentation. So you all can see the presentation?
Yes, sir, we can see.
All right, okay, right. So it's about mental health literacy. So you know about literacy, you heard about literacy because you know that sometimes we are using media literacy where we teach our children about the pros and cons of media and outcome of the media influence. So it's media literacy. So like that, this is a mental health literacy. So it's a huge topic and you can discuss it for days, but I make it sort of short and sweet and to not to spoil your mental health. Right. Mental literacy, you know, mental health literacy refers to knowledge and beliefs about mental disorders, which aid their recognition, management, and prevention. This is the first definition they develop. So poor mental health literacy can be an obstacle to providing treatment for those in need, and it's a particular concern in low and middle income countries where mental health services are already so it's improving the mental health service and treatment. But later they have come to a sort of change their definition. Later, they define that it includes the knowledge that benefits the mental health of a person and others, including knowledge of how to prevent mental disorder, the prevention part of mental disorder, recognition of disorders when developing, knowledge of effective self-help strategies for mild to moderate problems, and first aid skills to help others. So it's now a little bit changed. Mental health literacy has been defined as 4 different topics. Understanding how to obtain and maintain positive mental health. The second one is understanding mental disorder and their treatments. The third one, decreasing stigma related to mental disorder. And the fourth one, enhancing help-seeking efficacy. So today I thought I am going to discuss only the first part of the mental health literacy, that is understanding how to obtain and maintain positive mental health. So which will be useful to everybody. So mental health is, this photograph I have taken in the Kovil festival in Vanni region. So people are having sort of positive mental health mainly due to connectedness. So when they are connected to the place, when they are connected to the people, even when they are connected to the workplace, they feel happy. So mental health, basically, I feel it's a connectedness with live objects and inanimate objects. So the recent article, that is November Lancet, and they have mentioned 2-3 things. So during the 78th UN General Assembly in New York City, you know that it happened and our president also participated. Mental health was included in all 3 political statements of the health high-level meeting. So there are universal health and those things. So The latest Declaration of Universal Health Coverage has, as a point one, reaffirmed the right of every human being to the enjoyment of the highest attainable standard of physical and mental health. So they have incorporated mental health and giving importance to the mental health. TB and mental health. The third main discussion was about TB. Even tuberculosis has a complex relationship with mental illness, including stigma and discrimination that can prevent people seeking treatment. And 45% of the individual with tuberculosis have a depressive episode. So mental health is affecting whole human life as well as even the disorders. So they are in the recent Lancet Psychiatry. So mental health. So definition of mental health, their definition is there. There they have mentioned 4 things. One is realize their full potential. So you have to know your potential and cope with the stresses in life. So you have to cope with the stresses in life. Work productively. Your work should be very productive. Make meaningful contribution to their communities. So mental health, their definition is containing these 4. So I started thinking of giving another definition, which is an adjustment of a human being. Mental health is an adjustment of a human being to the world and to each other with the maximum of effectiveness and happiness. So this is a different. So now the psychology and there's a paradigm shift in the thinking about mental health, proposing that well-being is an alternative to the dominant disease model prevalent in the sector. So we are now talking about positive psychology, positive mental health, but mental health is a big umbrella. So everybody is putting a lot of terms under that umbrella. So we have to know what do you really mean by the terms we are using in mental health. So mental health won't be a single individual's problem. It's contributed by mainly the society and the cultural and political environment. Even the political environment of a country is also affecting the individual's mental health. So I put it as a small 3 areas we have to be concerned. That is love, work, and play. Play in the sense it's a pleasurable activities or hobbies. Work, your career, and the work. Love is a relationship, attachment, or a kind of relationship. When you are considering the children, the work and the play is one domain. But for an adult, it's 3 components, mainly the relationship, the work, and the play. So the complexity of the mental health, I have put a slide this here. You can know the social capital or social support and the social structures and the community's resources and individual factors and cultural values all are affecting your mental health, right? So then only we can understand the mental health complexity. You don't need to worry about too much because recently I had a patient, a client, who was depressed, a mother of 3 children, age around 58. So the depressive symptoms has been there for the last 6 months. But the main problem, actually, she has developed a cataract in both eyes. After that only, she started to scare and thinking that I'm going to lose the vision or something and to become depressed. So the first intervention I did, I referred to eye surgeon. And he immediately did the cataract surgery. The vision became normal. And after that, the depressive symptoms started to reduce, and with a small medication for the sleep and other things, she has improved a lot. So the intervention, that cataract surgery, is a mental health intervention to that person. So now you can understand the mental health. Anyhow, we have to be careful about this thing because most of the people, we usually ignore the social determinants of the health. But it has been established that social determinants of the health is very important regarding illness and the well-being. The condition in which people are born, grow, live, work, and age. So these conditions or the circumstances are shaped by families and communities and by the distribution of money, power, and resources at worldwide, national, and local levels, and affected by policy choices at each of these levels. So this is the determinants of health, and there is a specific topic is there, the social determinants of mental health. So the WHO said that there are structural uh, determinants, which are proximal and structural determinant, and social stratification, that is actually status inequalities between individuals and a social system. So discrimination, and there are inequalities due to money and power and some kind of social status will also determine your mental health. The structural determinants, fundamental structures of the nation, state, and generate social stratification, such as national wealth. The Sri Lankan national wealth is also affecting our mental health. And then the income inequality and the educational status and an opportunity to going school and educated, sexual and gender norms, and ethnic group. Even ethnic minority have a different kind of mental health problem. So you can see the determinants. It's affecting the social level, like the discriminatory policies and other things, social protection policies. Then the community. It's like about housing, about job and poor working conditions, and relational separation from families and peers. So people who are working away from the family, having mental health related problems, and your individual level. There are a lot of things, right? So individual determinants mainly regulate your emotions and thoughts. The learning from the experience, so which is one of the most important ability where we have to learn from experience, and managing conflict, especially the conflict resolution, having a skills of how to solve conflicts. The tolerate life's unpredictability, especially in a COVID time, we had a real unpredictability in life. So tolerate life's unpredictability is one of the important determinant. And there are social determinants also. The benefits of a strong early emotional attachment, one of the important social determinants. It's like you are developing an attachment with a mother or a carer, or in the early childhood is one of the important factor contributing a long-lasting mental health. So it's a benefits of a strong early emotional attachment. So that is the attachment developing between mother and the child. It determined by several factors. And you have to develop a secure relationship with affection and trust. So the first factor is also influencing the second one, but to developing a secure relationship. And ability to communicate, negotiate, participate. So these are the determinants. So mental health is a spectrum. You know, there's one hand, there's a mental illness. On the other side, you have a mental illness. So mental health is an umbrella term encompassing a range of mental health status, from diagnosable mental illness and mental health difficulties at one end of the spectrum, and mental well-being as a state of flourishing at the other. That is a kind of a subjective well-being. So mental well-being is a positive state, right? So this is one of the most important slide, because it shows the spectrum. It's like your IQ, there's a bell-shaped curve, like your mental health also like a bell-shaped curve. This is the community. So here the red color is showed that mental disorder, which is some 5 to 10% in the community. The green color is showing that flourishing in a very happy, very energetic people having a very good subjective well-being or happiness. That is also somewhere in 15 to 17%. So both 10. But in between, people are having languishing, Languishing are people who are not mentally very happy or well, but they don't have the mental illness as well, but they are having a mental health difficulties. And other people, quite a percentage of people, most people are having mental wellness. So this you can even apply to a school or a classroom for this, or even your workplace. Right. So flourishing is a word is kind of a positive mental health. It's more than the feeling happy. It's, even you can call it as a subjective well-being. Someone with a positive mental health and high well-being is feeling good, functioning well, has a satisfaction with life, in a developing as a person, and has strong relationship. So this flourishing that I have put in the green color on the top on the end. The other one is a languishing. Languishing, it's hard to get motivated about anything. You know, some of the people you can see. Sometimes we also had those things. So it's hard to get motivated about anything. You don't feel like yourself, and you may not able to figure out why. It's kind of a burnout or something. You are not ill exactly. You are not ill. Because the illness is in the red color. The next one is a languishing. And, and you try your best, but it takes you a long time to achieve what you need to do. So you can now understand. So this is the most important slide you have to know, because these are the main spectrum we can see in the community. So actually we can, doing some of the intervention, we can move this towards flourishing. So now you can see the red color is now reduced, but the green one is increased. So if you promote mental health services or mental health things in a whole community or your workplace environment or a school, that make kind of this shifting. So this is most important thing. So you can shift that and reducing the common mental illness and increasing the number of flourishing people in the community. So this is the spectrum. One is mental illness. Some are having only mental health difficulties, but they don't have the mental illness. Some are having real psychological stress. Some basic stresses and difficulties. So these are the spectrum. So stress, we have most of the people nowadays, they are talking about stress. It's become a very fashionable thing now. People always telling I am working in a stressful condition. But it's a relative term, because people who worked in a paddy field, they are not complaining of stress. But people who are working in a bank or somewhere in an AC room are complaining of stress. So it's a relative term we have to find. Actually, the defining particular relationship between the person and the environment actually is the imbalance between the impact of the need and the resources. When you have good resource, you can meet or you can face the impact or need easily. If you have a less resource, then it's difficult. So stress is a imbalance between the impact and the resources, and it's actually it's a byproduct. So we have to know that stress, because most of the people, they are feeling stress and they are always talking about mental health regarding stress. So it's a non-specific response to the body, and it's a byproduct of a poor or inadequate coping. So everybody's experience stress in a different way. So stress can be varied by your environment, your past, present, and the social economic situation you find yourself in. So it depends on your resources. There are positive stressors, because most of the times medical students and the PG trainees are complaining about stress, about studies and everything. Some of the stresses are very important. That is what you call eustress. It motivates focusing energy for a short term. So giving a deadline or target is very important. And positive is perceived as within our coping abilities. Those stresses are within our coping abilities. So Trauma is difficult. So trauma, you can't say it's a positive stress. Trauma is beyond your normal human experience. So stress means it is actually within your coping abilities. And sometimes positive stresses are exciting. In a marriage or somewhere, in a the wedding day, you have exciting positive stress. And it improves the performance for a certain uh, limit, certain level. If it is more and more, it's become difficult. So negative stress is a distress. So not always stresses are distress. Some positive stresses are very important, like exam and target and some deadlines for some presentation. But negative stress, of course, beyond this certain point, it causes anxiety, right? Can be short term and long term. And we perceive that this is outside of our coping abilities. And most of the time it's unpleasant when it's negative. It decreases the performance. So if in an exam, if a person is having stress for an initial period and with the stress increases, when the exam is coming closer to closer, that positive eustress increases the performance and studying ability. But after some point, as a breaking point, it reduces the performance, right? So can lead to physical and mental problem. You can see most of the people nowadays, children are admitted to the hospital with the somatic symptoms before the grade 5 scholarship exam. So that is, they can develop physical and mental problems due to negative stress. There are toxic stressors. Nowadays, we are talking about the toxic stress. Toxic stress response can result from strong, frequent, prolonged adversity without adequate support, right? So if someone is struggling, they should reach out. Usually when you are feeling that you are in a toxic stress, you have to get some help from others. So adversity refers to hardships, challenges, or misfortune. Most of the people, our people are talking about academic stress, mainly in academic field. So all the people, most of the time, coping with stresses, unless there's a big disaster or trauma or something beyond our control. But most of the time, we are coping. So coping is our choice. Our human way is coping, not dying or not going away from the stress. So coping is an ongoing dynamic interaction process that we have to know. So whenever we get some stresses, with our resources, we are coping most of the time. There are 3 or 4 types of coping. Some are coping in an adaptive way, some are coping in a maladaptive way. So example of maladaptive way of coping is deliberate self-harm or suicidal attempt or self-cut like that, or taking alcohol for the solution. Adaptive one is there are several. You can you can talk to a good friend regarding your problem. You try to solve the problem with the help of others and praying, going temple and other things. Adaptive. Sometimes we are focusing emotional focuses versus problem solving. Sometimes we started to, after a stress or something, we develop a intense emotion and we try to sort of focus on the emotion rather than the problem. So sometimes we can problem-focused coping. You can deal with constructively with a problem. Some are transformed versus regressive coping. So transformational coping, taking constructive action to change the stressor. Sometimes you can't change, but at least most of the time, if you can change the stressor, this coping option emerges from a sense of internal control, sense of challenge, and sense of commitment. Actually, this is what you call fundamentally optimism. You are optimistic to face everything and transforming the problem. Sometimes we are going in a regressive way. So that regressive coping, actually, it's kind of a pessimism. You are trying to avoid it and you are going into sort of a downward spiral towards the pessimism. So these are the coping, because that is the most common problem. In our country, why mental health literacy is needed There are a lot of self-stigma is there in our country. That is an extreme view on the value of self-reliance experience. That is believing extremely in a self-reliance. Whereas there are negative attitudes about help-seeking and extreme self-reliance behavior prevent them from disclosing their symptoms or engaging in professional treatment. So I have seen a lot of medical professionals, when they are having a real self-stigma, that they started to believe on their self-reliance behavior, they don't want to come and get some advice, or they're really in a denial, and they are not going to take part in any professional treatment. This is the big danger in our country. So self-stigma is one of the important problems you need to address. So mental health literacy main aim is to sort of handling the self-stigma. Right. So now you can see where are you, whether you are in a mental illness, languishing, or mental wellness, or flourishing. I have put that slide so you can think where are you now. Other one is how good mental health. Mental health is more than mental illness. So what are the important things you need to have? Sense of self-sufficiency or self-esteem and self-acceptance. I used to use the term self-acceptance, accepting yourself with your positives and negatives. So that is one of the important things. The second one, ability to put one's trust in others, trusting others. Developing trust. It all depends on your attachment, your childhood attachment, whether you develop a secure attachment. So that will lead to a trust in others. The ability to give and receive friendship, affection, and love. So this is relationship, whether you can developing a good, secure relationship with another person. The fourth one, ability to form emotional attachment. It's not a superficial relationship. It's a deep, very emotional relationship. If you can able to do that, you can have a good mental health. The other one is ability to experience deep feeling. So when you have a severe guilt, if you are able to feel that in yourself and others, that is one of the important things for good mental health. The sixth one, ability to forgive oneself and others. You have to forgive yourself and sometimes you forgive others. Then only you can maintain the relationship. The ability to examine oneself and accept others as ourselves and change. So it's changing, the learning and changing. Learn from experience and ability to, through self-reflection, when you started to change your things, your views, your attitudes, that is another important thing. And learn from past experience. Ability to tolerate uncertainty and take risks. Sometimes you have to take risks. So you can't stay in a comfort zone every time and to urge for a success. So sometimes you take risks. Sometimes you have to tolerate uncertainty. So during the COVID time, we tolerate a lot of uncertainties. And the ability to engage in reverie and fantasy. Is fantasy mean this is sometimes you are thinking in a impractical way, imaginary, and those things. Those are also good for mental health. Don't think that those are bad. Unpractical ways of solution and imaginary, fantasy, all are important. So these 10 things, you can assess yourself whether you have a good mental health or not. Well-being is a little other term people are using. That is feeling good and functioning effectively. Two things. Actually, stress relates to wellness in two ways. On the one hand, constructive adaptive stress habits will contribute to wellness. Like after diagnosing diabetes, a person started to develop a stress reaction. But that stress reaction can contribute to the dietary habit change and other things. On the other hand, living a wellness lifestyle or healthy lifestyle or a mentally good mental health will help to minimize the distress. You can cope with the distress. So there's two ways, stress and well-being. So So the psychology building, there are few things they have put, but out of all, these 6 things are very important. So if I have already mentioned, but put it as a nutshell. This is self-acceptance. I have already mentioned. If you have a good self-esteem, that you are trying to accept yourself with positives and negatives. And when you started to accept you with positives and negatives, you can able to accept others with positives and negatives. So that is important. And the positive relations with others, trust, and you're really trusting, deep, emotionally rooted, enduring relationship with others is one of the important things. Autonomy. You have to self-autonomy, like taking decision and taking responsibility for your decision. Those are very important. And environmental mastery. So dealing with others, the whole environment, you have to be very mastering in that. Say interpersonal relationship, personal skill. If you master it, you can manage with other people. Like that, there are a lot of skills you can discuss under environmental mastery. You have to develop a meaning in life, a purpose in life. Usually, you can see there's Viktor Frankl book is there, Man's Search for Meaning. So you can read that book because you have to have some meaning. You have to develop a meaning. Because life is difficult and stressful, but you have to make some kind of meaning in your life. The final one, you have to grow. That is personal growth. So you have to grow, right? So when there is adversity and problem, this is the small slide you can see. When you have a favorable outcome, when the stress is within your coping abilities, you become competent after that. Like doing an internship, then people become competent enough. If it is very high stress, you have to sometimes developing a resilience, that is bounce back from the adversity. So some people are developing resilience. Most of the people are developing competence after having a manageable stress within their capabilities. But even some of the people after trauma or severe adversity, they become resilient following that. But sometimes you may go into a vulnerable person after having adversity. Maybe a childhood adverse events in the childhood leads to vulnerability in your life. You become a more vulnerable person in your life course. So this is a small other important slide you can think. Where are you? So mental disorder, now we have started talking about psychological well-being, mental wellness, mental health, good mental or positive mental health. Now we will little bit about mental disorder. It's a mental disorder comprises a broad range of problems with different symptoms. It's actually having an abnormal thoughts, emotion, and behavior. 3 more important components and affecting social, work, and family. The domains it's affecting is social domains, work domains, and family. That's example schizophrenia, depression, intellectual difficulties, substance use disorders, and a lot of things are there. Those are mental disorders. I have put red color in that bell-shaped curve, which is somewhere in 5-10%. So factors contributing mental health problems, you have to know. Mostly we have to see biological factors, some genes or brain chemistry. Some of the brain chemistry leads to mental disorder. So which is sometimes influenced by the gene, and gene itself having a problem, giving a problem. And the life experience, early childhood adverse events lead to a lot of mental disorder. Like that, your trauma and abuse, having those life experience also lead to mental disorder. And the family history of mental health problem. Like that, there are factors contributing mental health problem. So some of the risk factors I want to sort of put it because then only you can understand. Or you can able to sort of coping with all these problems. Like most of the people are having experience of rejection. That is what we call rejection sensitivity. Sometimes people, when they become low and when they become very anxious, started to feel rejected. So that rejection sensitivity is one of the important components. So experience of rejection is very important. And lack of warmth and affection. When you are lacking affection and warmth, you can see in child and adolescents clinics, when they are lack of warmth from the parents and lack of affection from the parent is one factor developing mental illness. And harsh or inconsistent parenting or discipline style. So harsh and inconsistent discipline, social isolation. When people started to isolate from the social and started to stay in a classroom, one or two child, when they started to isolate, you have to be support that person because that is one of the factor contributing to mental illness. Poor social skills, say maladaptive coping or aggressive coping, only emotional coping, and sometimes they are coping in a different way. So poor coping skills is one of the important things. Low self-esteem is important. I have already mentioned self-acceptance and self-esteem. So low self-esteem is one of the factor contributing to mental illness. Alienation is like social isolation, alienation, completely alienated. Impulsivity. Impulsivity is one of the important problem because most of the suicide related to impulsivity. So impulsivity is a risk factor. Difficult temperament. It's like personality or earlier difficult temperament. Then some more risk factors, specifically physical, sexual, and emotional abuse is one of the important factor. Childhood, this sort of abuse is having an immense impact on the life course. Divorce and family breakup is also one of the risk factor. Family violence, domestic violence, and disharmony is one of the important things. Always nowadays in Sri Lanka, having a lot of mental health issues related to unemployment and job insecurity. So unemployment, job insecurity is contributing mental illness in the community. Unsatisfactory workplace relationship is also important. So when your workplace in a hospital or a ward or something, unsatisfactory workplace relationship is very important. So you can discuss about the workplace mental health. So intervention is, the basic. You can do the prevention in like universal, selective, and indicated preventions. Like selective people who are having a hyperactive symptom, you can do intervention in a school. Sometimes indicated, individualized. The treatment. So treatment also, early treatment is very important. You have a standard management is important. And the community care, mainly long-term care. But mental health, mainly it's mental illnesses are mainly chronic relapsing illnesses. That's why we have to be very careful because it's not a single episode like pneumonia. It's a relapsing chronic illness. So prevention have a lot of, like I have already mentioned about the social determinant. Prevention also, there are a lot of social prevention, structural prevention, situational prevention from society to individual. So I have discussed most of the things under this topic. I really wanted to give some recommendation to the people who are in the workshop or in the presentation. So these are the 10 important things I can recommend to you. Make time for yourself and take control of your time. Another important thing. So that is very important for your mental health. Develop a method to calm yourself. You have to develop. This is not a universal thing. It's not a solution for every problem, but you have to develop your own way of calming yourself. Join the activity movement. A voluntary movement, voluntary service, or some kind of activity is very important. Act happily and settle for less than perfect. When you become very perfectionist, I think it's very difficult. You feel dissatisfaction and you feel not accomplished, then you have a lot of problem. Take good care of yourself. Focus beyond the self. You have to take care of yourself. It's part of self-acceptance. But you have to think beyond yourself also. Don't be selfish. Set limits, plan for future. Don't think like a mania and grandiose ideas, but set limits and plan for future. And analyze what you love and hate about your work. So you have to cultivate from that. Give priority to close relationship. So priority has to be given for the close relationship. Nurture your spiritual self, because that is one important area, giving meaning and sometimes calming yourself. That is an area. Cultivating a good supportive social network. So these are the recommendations I have put. And habit, you need to be a effective stress manager when you are a manager. Most of the time we are doing even medical or wherever you are managers, and you have to manage your stress. They know how to relax. They eat right and exercise. They get enough sleep. They don't worry about the unimportant stuff. They don't get angry often. They are organized. They manage their time effectively. They have and make use of strong social support system. They have a good social support system. They live according to their values. That gives some meaning to them. Have a good sense of humor is one of the important things to managing your stress. So this is my, so the last message I wanted to give, a traditional Tibetan saying that if your mind is not contrived, it is spontaneously blissful. Just as water, when not agitated, is by nature transparent and clear. Thank you.
Thank you very much, sir, for your very informative lecture, sir. We have received few questions before the lecture. Of them, there's one question: management of stress and anxiety at GP level. What can be done at a GP level is a question, sir.
Yeah. So one of the important thing now they have recently JAMA article journal, they have published an article regarding exercise. It's a 10-year long-term study. They have found exercise is very much effective. What they say is you can even prescribe exercise, especially in adolescent kind of depression and anxiety. So mainly I have seen 1/3 of the adolescents are developing either depression or anxiety. One form of exercise is one of the important intervention you can do. And there are traditional calming mechanisms like breathing, deep muscle relaxation, praying. There are a lot of traditional calming techniques you can give or you can advise them to do. If it is severe anxiety, then you have to treat or you can do some psychotherapy, cognitive behavior or some kind of psychotherapy for those people in a GP level.
Okay, sir. There's another question. The management of an aggressive patient in the ward setups.
Yeah, there's several ways. Most of the time, the aggressive patient become more aggressive after seeing a doctor or somebody. So we started to sort of increase, or we started to promote the aggressive. So better you can verbally talking to nicely and talking to verbally, you can do a management. And even though if you are not able to do it, then there are chemical kind of intervention, pharmacological intervention with the help of a team rather than going into a single person, helping with a team, how to control, how to, without making an injury, how to handle all are important. There are few ways to do that. So most of the time I have noticed that talking nicely and accepting, showing some empathy, most of the people started to respond in a calm way.
Right. Okay, sir. Now that seems to be the questions. Thank you very much for your time lecture. I'm seeing that the link is currently not working, but hold on a little longer. We'll send you the correct link to obtain your CPD points and e-certificate. So please remain. I thank Dr. S. Sivathas, consultant psychiatrist, teaching hospital Jaffna, for his very informative and timely lecture, which is very important in the current context of Sri Lanka. And I hope you all will join in the next week's CPD webinar lecture as well. Thank you very much, sir. And thank you everyone for joining in today. Please wait in the chat box. We will put the correct link for you to obtain the e-certificates and the CPD points. Thank you.